This segment is sponsored by Capital Caring Health. Capital Caring Health is celebrating 2 years of care for people in the area at their inpatient hospice care unit at Sibley Memorial Hospital. Here to tell us more about the Washington home is Steve Cohn from Capital Caring Health. Welcome back, Steve.
Thanks, Ellen. So glad to be with you today and to talk about this critical facility. So
Yes.
most hospice care is provided at home.
Right.
But 5% of the time, usually in the last few weeks of life, a patient needs around-the-clock care to make sure that they're pain-free and comfortable.
Okay.
And if that's the case, we move them into one of our 2 inpatient facilities. And there's only one provided by a hospice group like us in Washington, D.C., and that's on the grounds of Sibley Memorial Hospital.
Okay.
And we opened it a little over 2 years ago, and we were able to open it thanks to a generous grant provided by the Washington Home Foundation.
Yeah.
Because these aren't cheap facilities to run.
Right. Right. And you are the only nonprofit hospice in the district. You are also now the only one that provides this physical inpatient facility. Why was it so important for you to have this?
Because Washington needed one. And that's why the Washington Home Foundation and Capital Caring Health got together about 3 years ago and decided that we really needed to figure out a way to have an inpatient facility in Washington. We had actually had one many years ago at Providence Hospital, which was shut down about 3 years ago. So it was really imperative that DC have one. And it's a 10-bed facility. It operates around the clock, 2 nurses for every patient on 3 shifts. So it's a very comprehensive type of care.
Someone's there, they're caring for your loved one and making sure.
And you
that
can
they're
visit your
comfortable.
loved one around the clock. You can stay with them overnight.
It's wonderful.
And it's just a wonderful thing to have for people that need that type of end-of-life care, because there's no place else to get it around here.
Yeah. Oh, I'm around here, around the country. It sounds like these
Yeah,
are very few.
they're few and far between.
Okay.
You know, in the case of our Sibley Center, Medicare and Medicaid only pay about 50% of the actual cost. So we really rely upon philanthropy. We rely upon the Washington Home Foundation to continue helping us, which they do, and we're very grateful for that.
Yeah.
And we just see how patients love and their families being in this type of facility, which is not like a hospital. So even though it's in the hospital in this case.
But it's different. You mentioned philanthropy. You raise funds to help operate it. How do you do that? How do you go about making sure that this can be operable?
Well, yes, we rely upon individuals, businesses, and foundations, and you know, we like to make the point about how essential this facility is. 60% of the patients are people of color, and there's always a few that are we treat that are homeless, so we turn no one away. If they have no insurance, we cover that thanks to philanthropy, thanks to the Washington Home and other folks.
I wanted to ask, so it sounds like care like this, when you have someone there with you around the clock, it could be expensive. Are there fees associated with this? What do the families and the patients have to take on?
The only thing they have to do is make sure that we get the patient to the facility. So there's no fee.
Wow.
And Capital Caring Health, like other not-for-profit hospice groups, we care for everyone regardless of ability to pay. So, and when you think about the end of life, it's either hospice or hospitalization. And hospitalization can be very expensive for the patient and the family.
Right.
And whereas hospice is free.
Yeah, you think of the medical bill when you leave a hospital anytime.
Right. So our facility at Sibley Memorial Hospital, and they're great partners, they're thrilled that we have this inpatient facility that's so very special for Sibley Memorial Hospital and for Washington, D.C.
And it is visiting hours like the hospital, or it's around the clock?
Well, Sibley is one of the few hospitals that has the same visiting hours we have, which are none.
Okay.
People can come and go at any time, day or night.
Okay.
Patients, loved ones, friends, close friends, family, they can come and go.
It's amazing.
They can stay with the patient overnight if they wish.
Yeah, it's a hard enough time for someone in their life. People are probably listening saying, you know, I want to support this, I want to help out. How do they do that?
Get a hold of me.
Okay.
they should go to capitalcaring.org and they'll see a donate button, and they can see all the various options for donating, one of which is our Sibley, Washington Home Capital Caring Sibley Center.
Okay, so they can do it right to where they want to donate. Thank you, Steve. Always good to talk to you. Thank you for what you do. You can get more information on how hospice care can help you and your family by visiting capitalcaringhealth.org.